It's time again for Medical Monday here on eRadio with Dr. Dylan Joseph, and today we are discussing astigmatism. A very big hello to you, Dr. Joseph. How's it going?
How's it, Ian? Very well, thanks yourself on this good Monday.
Yes, no, great, thank you. New week, new beginnings, new month. It's spring has sprung.
That's spring has sprung. That's it. Absolutely, but it's still cold. What can we do?
Yeah, it's always like that. Yeah, but anyway, so today talking about astigmatism, let's just quickly recap on the term. What is astigmatism?
Yeah, so we'll go back all the way to episode 1 when we discussed refractive errors. So refractive meaning how light is transmitted through the eye, and you get short-sightedness, far-sightedness, and then astigmatism, and that comes in a combination with short-sightedness or far-sightedness, or as a standalone, as pure astigmatism. And all that means really is that, you know, the eye is essentially shaped like a rugby ball. When light travels through it, it's going to travel through it in a way it travels through a sphere or a cylinder or a combination of the two, so spherocylindrical. So the sphere would be short-sightedness and far-sightedness, and in the cylinder would be astigmatism component. But the easy way to think of it is that the eye is shaped overall like a rugby ball, and a rugby ball has a long, flat part of it and a shorter, steeper side to it. If you think of a rugby ball standing up on the tee, vertically is the long flat axis, and 90 degrees to that is the shorter steep axis. And the cornea, or most corneas, have some form of cylindrical correction, or they've got some form of astigmatism in the cornea. And astigmatism essentially causes blurred vision. Most people's symptoms with astigmatism are going to be poor night vision, a glare, and a little bit of ghosting of images. So nothing really is quite clear for your distance vision or your near vision. And you know, most people can cope with astigmatism in their visual system up into about 0.5 to 0.75 diopters, which is a small amount of astigmatism. The brain can phase that out. But beyond that, you're going to need correction.
Can this be fixed with laser, Dr. Joseph?
Absolutely. So when we do laser, we fix the astigmatism on the front of the eye, or the cornea. So it doesn't matter whether the astigmatism is coming from the cornea or a combination of the cornea and the lens, but we can fix the eye's total astigmatism on the cornea. We can fix it with a number of other methods as well, which I'm sure we're going to discuss later. And astigmatism, one of the sort of misnomers or misconceptions is that you can't laser astigmatism. Even abnormal astigmatism, irregular astigmatism, and astigmatism from keratoconus, we can change the shape of that, not to see you to allow you to see better without glasses, but to allow you to see better with glasses or contact lenses. But astigmatism that is regular and normal, we can laser up to 6 diopters of astigmatism on our current platforms quite comfortably to get you out of specs and contact lenses. So yes, you can laser astigmatism.
Okay, and can we fix it with lens surgery?
Yes. So once again, it's very important as a clinician to understand where the astigmatism is coming from. Is it from the cornea, the front of the eye? Is it from the lens inside the eye? Or is it a combination of both? And we need to understand exactly how much astigmatism is on the front of the eye, the cornea, before doing lens surgery, so that when we do the lens surgery, we can now implant what's called a toric lens, which cancels out the magnitude of the astigmatism on the front of the eye. So we've got to dial it in onto a very special axis, which we calculate to make sure that we're getting a 90 to 95% chance of cancelling all that astigmatism out in the front of the cornea. Otherwise, you're not going to see very well after surgery. So, in fact, I'd say between 60 and 80% of my cases now, I am correcting astigmatism because I'm just so sensitive to the amount of astigmatic correction. I know that it causes poor vision after surgery. So you want to make sure that you're giving people the best shot at good vision.
Now, Doc, tell us about your new technology that helps you measure the astigmatism and help get the best result for your patients.
Yeah, so it's a wonderful piece of equipment. It actually, the patient sits in front of the machine, and it actually looks at registration data on the front of the eye, so blood vessels specifically. So it will pick up exactly where the blood vessels are. It then understands that the eye is situated. This is 0 degrees, this is 90 degrees, and 45 degrees relative to that blood vessel. So when you now say you need to implant a lens at 45 degrees, you simply take the registration image on a USB, put it into the microscope. You get a fancy heads-up display like the F-16 fighter pilots do when they're looking at their enemies
Wow.
in the heads-up. And basically, it's all dynamic, which means as the patient's eye is rotating or moving slightly, so the reference image moves slightly and holds you straight on axis. So you know exactly where you are going to implant that lens. You literally have a heads-up display thrown onto the patient's eye, which you can see through your microscope. And that helps you align it, as opposed to the older way of sitting and actually marking manually the axis. And of course, there's human error that can be brought into that. Whereas with it all digitally done, it really reduces that potential for human error quite significantly. So it's a great new acquisition. And because we're doing a lot of toric lenses or astigmatism correcting lenses, it makes a big difference to our workflow, to patient satisfaction, and results at the end of the day.
Dr. Joseph, can astigmatism be corrected with implantable contact lenses?
Absolutely, Jan. The whole beauty of understanding astigmatism is not only what is involved in the patient's eye, but what you're inducing by making your surgical incision. So, like we can correct it with cataracts using toric lenses, when a patient is either not a candidate for LASIK or they prefer to have an implantable contact lens put on top of their own human lens, and they've got a certain amount of astigmatism, we custom make these or custom order these lenses. These lenses come from overseas with the patient's name on the box, with the amount of astigmatism built into the lens at the specific axis. And all we do is understand the reference image that we need and the axis that we're going to implant it into on the patient, and the lens does the rest of the work. So absolutely, and we can correct with custom-made astigmatism up to 12 diopters, including 20 diopters of short-sightedness or myopia and 12 or 15 diopters of farsightedness. So it's giving us a range of vision correction way beyond laser vision correction. And if you don't want to go and remove the human lens, there's really great options. And we can use these implantable contact lenses up until the age of 50, 51 if there's no cataract changes. In fact, I did that for a patient the other day. And she's delighted and spectacle-free for both reading and for distance.
Fantastic. That's astigmatism in a nutshell today on Medical Monday. Dr. Joseph, thank you so much for your immense and valuable contribution to eRadio and Medical Monday. We really appreciate it.
Wonderful to be part of it, Jan, and happy birthday for last week, and all the best for your third year of success.
Thank you so much. Dr. Joseph. Much appreciated. Until next week.
Pleasure. Yes. Excellent. Cheers, Jan.